Hi, Dr. Connie here. So our Lupus Rebels support group is growing rapidly, which is great because we can have open discussions about our individual struggles with lupus, and boy, do they vary. While some may be concerned with fatigue and or rash, many have compounding diagnoses such as interstitial cystitis to PCOS, fibromyalgia, RA, MS, Sjogren's, and kidney disease. Many of you have heart, nerve, and blood pressure issues that you are all on medications for. And while temporary management of the symptoms warrants medication, you really need to think about how all systems get broken. So being a lupus rebel is about fighting for your health as lupus or other disease conditions try to attack your body. Here's what I mean. Initially, my lupus began with just fatigue, rash, pain, and hair loss. But I knew there was a lot more brewing under the surface because mysterious and scary symptoms like projectile vomiting, scary low blood pressure under 50, tremors, headaches, and heart palpitations, and debilitating pain kept me in and out of the hospital. And with each visit, my medication list grew. And from spinal taps, which is very painful, to rule out meningitis, to CT scans, countless labs, to electrocardiograms, lupus was affecting every part of my body, and it was very clear. So a few years went by, but I was far from optimal. I got married, started a family, and just when I felt like I had everything under control, I was diagnosed with glomerulonephritis. I blew up almost overnight, 25 pounds on me in fluid, and my whole body was swollen. And in retrospect, during the few years I thought were clear of flares, I wasn't feeling my best as I struggled with everything. But of course, we just roll with the punches and assume that that's just lupus. Fast forward, panicked doctors admitted me, biopsied my kidneys, and found I had the worst kind of glomerulonephritis stage 4 due to lupus. My nephrologist gave me his spiel about the risks of the treatment I was about to undergo and advised me to sort of get my life in order. This meant that I should freeze my eggs if I were to get pregnant, and he didn't know what the outcome would be since the percentage of people that fully recover is under 10%. And he told me we would try our best to avoid dialysis. When I asked if the nephritis would heal on its own, he held back his frustration by saying that I'm very close to losing my kidneys, as my protein loss was dangerously high, indicative of permanent kidney damage. So this caused a big shift for me. Everything got real and life changed. The treatment involves Cytoxan infusion, which is chemo, for about 12 months, once a month, with high dose of Medrol injections, coupled with anti-nausea medication. Then if my kidneys respond, I can graduate to a less toxic CellCept medication that helps to suppress my immune system further, and oral corticosteroids. The Cytoxan infusion was tough. Nurses would gown up from head to toe to handle this cytotoxic medication that aims to kill all cells in my body. They also tell you to flush twice after going to the restroom for 24 hours. This is to be sure nothing is left behind that other people may be affected by. During the infusion, you get a metallic taste in your mouth while this toxic medication is being infused. And this is what prompted me to really seek a solution to fight for my health. The infusion saved my kidneys and my life. However, I knew intuitively that I needed to strengthen my body to withstand such toxic insults. I shivered at the consequence, but I knew it was the only way to help myself at that time. I read, researched, and studied everything I can to help my body recover. I found macrobiotics diet, Eastern medicine through the herbal medications, Qigong, Pilates, Weston A. Price Foundation, Gerson's therapy, and of course, functional medicine. Not only did I study, but I got busy applying it to myself. Fast forward through 3 more relapses exactly like this. Yes, I fought stage 4 glomerulonephritis 3 times, and my doctors will tell you that they are astounded by my fast recovery. What's more incredible is that my kidney function is, they joke, at 110%, which is not what my doctors expected, not the first time, second, and surely not the third time. As you know what they say, 3 strikes and you're out. And that's what I share with you in my blog, Facebook, YouTube, and in my private Facebook group. The nuances of living, surviving, and thriving, and how to fight for your health. It takes so much more than a change in your diet, frankly. In order to heal, you need to heal from the inside first. I respect my disease, and I'm so thankful for the doctors who saved my life. But I am clear on their role in my disease, and I know that my health, it's on me. In order for you to win this battle, you've got to work at it one step at a time. It's a hard road to recovery, but who you become in the process is so valuable, because if it doesn't kill you, it really does make you stronger. I am so much better because of my lupus, as it's taught me so much about life, what to fight for, what really matters, and it's taught me humility, faith, and love. I hope this inspires you to tread forward and join our movement to fight for our health. It all starts with knowledge. Be empowered. Talk soon.